Well, thanks for taking the time to visit with us. I want to get to some of the things that you are suggesting need to happen here. I guess the good news is some of it's now happening.
It's true.
Right? Yeah. So I don't know. Finally, right? Have you been chomping at the bit for this to kind of kick in?
Yeah, I was really alarmed and worried, as were the two colleagues that authored the article with me, Alfredo Burlando and Eleonora Redailli. We were all really upset and alarmed about the lack of action on the University of Oregon's part. We know they've been planning for weeks, if not months, and there's many people who are involved who are smart, and they weren't pulling the trigger. They weren't doing what they needed to do to really protect students and staff and faculty and the larger community.
Yeah. And you've seen firsthand how this works in Italy. I mean, what's it been like for you? Can you describe the situation?
Well, it's unlike anything that I've experienced in my lifetime, and it's unlike anything that probably most people alive have ever experienced in their lifetime. And that means that the entire country of Italy, which is 60 million people, Italy's about the size of California, is now under home quarantine. So every single citizen is meant to stay inside their homes. You are only supposed to leave if you have a valid explanation that you need to go to the supermarket, a pharmacy, a grave medical emergency, care for a sick family member, or work that is not been halted. All stores, all unnecessary services are closed for the next 2 weeks. And the president of Italy was on the radio this morning asking us Italians to stay inside in their nuclear families, to not have contact. And he said that the goal is to make Italian towns look like ghost towns right now.
I think people, when they see this, some people, oh my God, it's draconian. It's so much, so necessary.
Absolutely necessary. Italy is taking the right steps, and they are reacting quickly to a rapidly evolving situation that can only be described as a public health emergency. It is gaining speed at a rapid pace, which surpassed initial expectations and plans here in Italy. And new infections continue to grow. And from a few areas in the northern part of Italy, which has a very well-functioning, well-developed healthcare system, with many doctors, many nurses, hospitals that look very similar to those in the United States, these hospitals are reporting that they're near capacity and that they cannot take many more new cases. They do not have enough intensive care beds. They don't have enough respirators. They don't have enough doctors and nurses to continue to treat patients if infections continue to grow. And that is the big if. We're at a really critical moment in Italy right now, which is why such severe restrictions are being put in place.
That must be. I mean, it would be worse if not for these measures, but it must be hard to see it right at the breaking point.
It's very frightening, and I'm scared, and a lot of people are scared here. If you're paying attention, you should be alarmed. And what has compelled us to write to the University of Oregon, and what has actually compelled us to write another letter to the state of Oregon that we're sending to Governor Brown today and to various newspapers across the state, is that this is a public health emergency that Oregonians should prepare for. And Oregonians lose very little by preparing for the worst and taking preventative measures that they ought to be taking right this very moment, and that cost them very little. And the biggest one of those is to practice extreme social distancing. And that means staying out of public places. It means working from home. It means taking your children out of school. It means canceling travel and behaving in a way as if local transmission is already going on in your community, because it probably is.
And here we don't have a great idea because so few tests have been performed.
And this is such a grave mistake on so many levels that People need to now take personal responsibility because institutions have failed at these early stages. They need to behave as if local transmission is happening in large quantities in their communities. And that means staying at home. Because one of the most frightening things about this is that many people who are infected and can infect others do not show symptoms. So that you feel healthy, you go about your normal behavior, you are not doing anything wrong when you go to your workplace. However, even just by being in your workplace, touching surfaces, interacting with others, you are exposing them. And right here in Italy, every single case is causing between 2 to 3 new cases. And most of those cases, they're not showing symptoms. They don't feel sick. So they're not going to isolate at home. And that is why it's so monumentally important right now that people take measures that might feel extreme. Why should I have to cancel plans with friends? I'm going to feel embarrassed to tell my friends that I don't want to go to the movies or the theater or a concert or a stadium. Now is the time to do those things because in 2 weeks, it's going to be too late.
That is, it seems like that's just one of the hardest things about this is that so many people may be infected, may be completely asymptomatic, maybe have very mild symptoms, and it's like, well, I got little allergies, but you don't know, and so then it goes to people who are at risk, and that's, I mean, it's such a dangerous situation, it seems like.
It is dangerous. And in one of the few Italian towns here where they tested the entire population in the town of Vo, they tested 95% of the population. Only 3% were infected. That seems like a very low number. That's great. Of those 3%, a vast majority had no symptoms at all. So that seems like a small number, and that's great that many mild cases are happening. But even with that small percentage, that hospital was overwhelmed. Overwhelmed. And the problem is that unless we assume we all behave in a way that assumes we are sick and that we are potentially a danger to other people for a short period of time, that's the only way collective public health is going to work in this
You know, this phone is awfully loud, sorry. There's a phone here that's I don't need to make
Okay.
noise. I don't know if you could hear it, but it's bothering me. So the governor just finished a big news conference with the Oregon Health Authority and Portland Mayor and others, and limiting gatherings over 250 people, doing some things, but not schools, not public schools. Your reaction?
This is the wrong decision. I have 2 children and I have a child who's in public school here in Italy. They canceled school 3 weeks ago as soon as local transmission was reported. And that was absolutely the right call. And if I was in Oregon right now reading the news from China and Iran and South Korea and Italy, my children would not be going to school. My children would be at home and they would not be having contact with others because children have very mild infections, and that's great. They mount a very strong immune response, and they're resilient, and very few children are getting hospitalized, which is good news for families. However, if a child gets sick, they will essentially infect everyone in the nuclear household. Through the regular care and interaction with that child, you will be exposed. And that means adults may not have that mild of a case. And each additional case um, it's a snowball effect into larger effects.
Um, People say it's just too hard to do in this country, right? We're too big, we're too used to our freedoms. There's just no way we can accomplish the kind of social distancing that other countries can do. No?
Italians are not great at following rules.
Yeah, right.
So when the measures were first passed that quarantined all of northern Italy about 4 days ago, the president went on TV and he appealed to Italians to not be clever in getting around the rules. Because Italians often pride themselves on a certain cleverness that a rule is there, but if the rule is not a good rule and it doesn't apply to me, I should go around that rule. And he said, this is not the time to be clever and it's not the time to get around rules. It's not the time to think about you individually and what is convenient or comfortable for you. And there's a rhetoric here that might seem overly patriotic or nationalistic, but it's a rhetoric of sacrifice. And the idea is that if individuals
No, oh, I lost you. Okay, we're going to go with this. You're
Okay.
sideways, but we can change you in
Okay,
editing, so it's okay. And I hear
got
you
it.
good and everything else. I won't keep you too much longer, but so the U of O at this point, online classes only, um, after spring break as well, right? For
Yep,
foreseeable, no large gatherings. Have they met what you think they need to do, or are dorms still open there? I'm not sure. I wasn't sure about
they
that. Or
are.
they are. So I mean, what more needs to happen there?
So I think one of the steps is that all of the study abroad programs should be canceled. As
Mm,
far as I understand, not all of them have been canceled for even spring term. And I think it's ridiculous to think that students should be traveling internationally right now away from their families um, to places where travel restrictions placed by our president are changing on a daily basis. Quarantine measures are changing on a daily basis. And it's one thing for me to be quarantined here in Italy because I've spent 18 years of my life going back and forth. I speak Italian, my family is here. I know how to get out and I know how to maneuver here. For an 18-year-old to be in a country where they don't speak the language, they don't necessarily have good contacts and support, that's not a situation that I would want one of my family members in. And I don't think it's a responsible situation to ask our students to be
yeah. Um, I guess just nationally too. I mean, what did you? What's your takeaway of from what the president put in place yesterday? Travel restrictions from Europe. Should there be? Is that just where do you see things? Yeah.
Yeah, I don't think it's the right response. I think it might actually be challenging some of the responses of making sure that goods and things move back and forth. He's promising that merchandise and mercantile items aren't going to be subject to this, that U.S. citizens won't be subject to this. But once flights start getting canceled, it actually gets quite difficult to make sure that supply chains remain stocked. And
Mm-hmm.
Italy is in a good position because we're surrounded by other EU countries that are essentially keeping open borders. And EU leaders have, I think, maintained a very steady overall tone and a very moderate tone about the importance of remaining open borders in the midst of an emergency
Yeah.
situation, and that there are important measures we can take internally.
Yeah. You're breaking up a little bit. Your audio. And I don't know. It's probably connection. I assume.
Yeah.
Um, So there, you sounded all great. I kind of didn't get your answer as well there, though. You want to restate it a little bit? I mean,
Sure.
you were just saying about the difficulty of that kind of a travel ban.
Yeah, I think the problem with the travel ban is that you worry it's going to hinder supply chains that are actually necessary for the emergency response. That it might hinder testing supplies or treatment or masks or gowns, things that maybe are coming through the United States. Because once you have a travel ban and flights begin to get canceled, it's harder to move things around. Italy's in a good position in that it's strongly surrounded by other EU countries that are maintaining strong open borders, and EU leaders are keeping a very moderate tone about contact and travel within the EU, which I think is very beneficial.
And some are saying too. I mean, it's here. It's already here. So
Yes.
a stronger effort in testing and preparing surge to treat, and those are the key
There's
emphasis.
there's a lot that the federal government and the state governments could be doing about preparing to find new facilities, making additional intensive care beds, hiring additional medical doctors, nurses, and support staff for the surges that will come. But I think that unfortunately, we've seen some failures of the health infrastructure already in the United States in giving timely and accurate advice to Americans and Oregonians. And if I was in Oregon right now, what I would want to tell people is now it's your responsibility to take proactive, preventative measures that may help not just protect you from getting coronavirus, but may help your entire community weather coronavirus in a more reasonable and sustainable way. And those are steps that people can do right now about social distancing, working from home, canceling meetings, not going out in public, and taking your children out of school.
Yeah. Now. Now.
Now,
Yeah.
now, not next week or 2 weeks from now.
Yeah. Um, I get, and all this is to, you know, get this curve to flatten out, right? Can you? I mean, I think that's such a.
Exactly.
Can you talk about that?
Right. So the idea is that you want to slow the pace of infections, that people are going to get infected every day. And that is an epidemic. You're looking at the epidemiological curve of the disease. How many new people get it? For each person who gets it, how many new cases do they cause? Right here in Italy, now each case is causing between 2 to 3 new cases. That's unsustainable. And if that continues, it will crash the healthcare system. There will not be enough beds, and hospitals will not be able to treat everyone who needs care. So when we talk about flattening the curve, we talk about reducing how many new cases are caused by each individual case, about slowing how many cases, slowing it down so that the healthcare system can breathe and absorb those sick people. People heal from coronavirus. They get the necessary care and they get pushed out the door, and that's a great success. We need to make sure that they have time to heal in the hospital, exit, and that bed is available for the next sick person who comes. If there's a wave of infections and that peak is too severe and it's too steep and that curve is too tall, that no hospitals will be able to manage it.
Yeah. And the science shows keeping away from each other helps that to lessen.
It's personal behavior, and it's a pity and it's a shame that the government, federal and state, is not messaging this to people aggressively right now. But it is individual behaviors that can help flatten the curve. It's individual behaviors that can help prevent you from getting sick. And it's individual behaviors that can help keep your community as a whole safer.
Terrific. Well, you're saying it. I appreciate that.
Work from home.
Yeah, I know. We in news, at least field crews.
You're critical. You're critical
Yeah.
services, but you should be either a mask to make sure you're not touching your face, gloves to remind you to not touch your face.
Right. I know. I'm terrible too with that. You've probably seen it. You probably noticed. I'm trying, and we've got a bunch of stuff around to do our hands, and we've got gloves. So,
yeah.
Supplies are short though. I don't know where the masks are.
Be careful, and tell your family members to just hunker down as much as you can. You do it for a few weeks, and you know what? If it passes, it's easy to go back and you're friends with everyone again, and you've lost nothing. Yeah. You read some books and you watch some TV. And if you're right, then you got yourself 2 weeks of potentially dangerous contact with people.
Yeah, for sure. Thank you very much.
No problem.
Before I let you go, I'm going to ask you. So you're there with 2 other colleagues. How, are you all there on the same tour, or how long have you been there? Or?
So I'm the other person, Alfredo Burlando, is my spouse. I'm married to him.
Oh, very good.
So he's in the same place with me, and we've been in Milan since summer. The other person, Eleonora Redailli, she's based in Milan, and she arrived in December. And we're all on research leave from the University of Oregon, working on our own research project.
How
but
long
we
are
all
you there?
know each other. We're supposed to be here until August.
Yeah. Do you think will you stay when things loosen up? Or?
Right now, we're going to stay because I actually think things might get equally bad in Oregon, and I have no interest in shifting from one spot to another bad spot.
Right. The curve may be on its way down there before it is here.
Exactly. So I think every day we look at the data here and we kind of reevaluate and look, and if it looks like transmission really picks up where we are, and I think it's an unsafe place to be, we will leave. But right now, I'm not convinced that Oregon's doing the things to keep residents safe that I actually want to be there.
Yeah. And you obviously have a love for Italy. It sounds like you've been a part of that country for a long time, huh?
Yeah, I mean, I've been back and forth to Italy for 18 years with my husband, with his
That's
family,
awesome.
and back and forth. So it's truly surreal to be a part of this because it's unlike anything you could imagine happening in your daily life.
It must be hard.
Yeah. It is. It's really scary, and I hope that it's not this bad everywhere because it's really stressful.
Yeah.